Good morning. Thank you for joining us on Facebook Live. I am Nicole Moccasin, the Community Health Worker in the Lincoln office. Today we have Ms. Lora Langley, our RN, and the Population Health Director. Today we'll be talking about sexually transmitted diseases. Remember, if you have any questions, please leave it in the comments. With any personal questions, please email or call Lora Langley. So, Lora, can you tell us what is an STD?
Well, first of all, I'd like to say that sexual health is an important part of your overall health care. And I want to also let you know that the Ponca tribe prides itself in offering exceptional services to the Native American community and provides a safe and inclusive space for LGBTQIA. So sexually transmitted diseases are, as is in the title, are sexually transmitted diseases. They really are not diseases, they're infections. So they've tried to move it over to STIs, which means sexually transmitted infections. There's several different kinds, so I'm going to start out with the most common, which is chlamydia. The number of chlamydia infections in Indian country is very high. In Douglas County, which is the county here in Omaha, is one of the highest in the United States. People who are sexually active can get chlamydia. It's common, it's treatable, and it can affect both women and men. You can get chlamydia by having vaginal, anal, or oral sex with someone who has chlamydia. The only way you can keep from getting chlamydia is making sure that your partner's been tested and you as well before even having sex. The other way is if you don't have sex at all. You can also try to be safe by wearing a condom, a male or female condom, but remember, those are not 100% effective. So you've got to make sure you put them on correctly and use them correctly. They can fall off, they can get punctured, holes in them, and so to be actually safe, abstinence. And I'm not pushing you to be abstinent, I'm just pushing you to be safe. I'm sorry. I want you to remember one thing. If you're pregnant, you can go to your provider and they will test you for your STIs. Automatically, they test pregnant women because chlamydia can be spread to your baby during delivery. It can cause eye infection or pneumonia in your baby. And it can also cause you to deliver your baby early. How do you know if you have chlamydia? Oftentimes it doesn't have any symptoms, but it can cause serious health problems. If symptoms occur, they may not appear until several weeks after having sex with a partner who has chlamydia. Even when chlamydia has no symptoms, it can damage a woman's reproductive system. Women with symptoms may notice an abnormal vaginal discharge and a burning sensation when peeing. Symptoms in men include a discharge from the penis, a burning sensation when peeing, and pain and swelling in one or both of the testicles, although that's less common. Men and women can also get chlamydia in their rectum. It happens either by having receptive anal sex or by spread from one infected site, such as the vagina, to another. While these infections often cause no symptoms, they can cause rectal pain, discharge, and bleeding. So see a healthcare provider, if you notice any kind of abnormalities. Like I said, it's Our providers are very sensitive to sexual health, and if you feel like you need any assistance or anything to get an appointment or to talk to someone, please give me a call, and they will give you my phone number at the end of the session here. You can be tested. They usually use a blood test, a swab, or just urine. So, it's pretty non-invasive. Is there a cure? Yes. The right treatment can cure you. They will give you medication for it. The one thing I want to be very clear on, you need to take all the medication they give you and make sure it's gone. And you also need your partner or partners treated. Because without them being treated, you're just going to be spreading it back and forth. So that's one of the main things. The next STI, is gonorrhea. Gonorrhea is an infection caused by sexually transmitted bacteria that infects both males and females. It also most often affects the urethra, rectum, or throat. In females, gonorrhea can also infect the cervix. It's the most common spread during vaginal, oral, or anal sex. Babies and infected mothers can be affected during childbirth. In babies, gonorrhea mostly affects the eyes, and the baby can end up being blind from getting gonorrhea. Abstaining from sex, using a condom if you have sex, and being in a mutually monogamous relationship are the best ways to prevent sexually transmitted infections. Some of the symptoms are painful urination, and these are for men, pus-like discharge from the tip of the penis, pain or swelling in one testicle. Signs and symptoms of gonorrhea in women is increased vaginal discharge, painful urination, vaginal bleeding between periods, such as after vaginal intercourse, abdominal or pelvic pain. Gonorrhea at other sites in the body, it can also affect the rectum, eyes, throat, and joints. When to see your doctor if you have any of the symptoms, or if you even suspect you were exposed. You need to see your provider. Some of the risk factors are having a new sex partner, having a sex partner who has other sex partners, having more than one sex partner, having had gonorrhea or another sexually transmitted infection. The complications of gonorrhea is it can cause infertility in women. It can also cause infertility in men. It can spread to the joints and other areas of your body. Getting gonorrhea can increase your risk of getting HIV and AIDS. To prevent it, use a condom if you have sex, and remember that is not 100% effective. If you even suspect your partner has an STI, STD, don't have sex with them. That's easy to say. Limit your number of sex partners. Be sure you and your partner are tested for sexually transmitted infections. Don't have sex with someone who appears to have a sexually transmitted infection. Consider regular gonorrhea screening. To avoid getting gonorrhea again, abstain from sex until after you and your sex partner have completed treatment and after symptoms are gone. And one thing I wanted to bring up is you can bring, if you feel like you have an STI, you can bring your partner no matter if they're Hispanic, white, African American, anybody. If you've had sex with them and you think you have an STI, or have been diagnosed with an STI, your partner can come here to be treated. And please have them treated or you will get it again if you have sex with them again, even if you're treated. Another common is Trichomoniasis. That's a hard one. And it's it didn't used to be considered a sexually transmitted infection, but it is now. And it's caused by a parasite. In women, it can cause a foul-smelling vaginal discharge, genital itching, and painful urination. A lot of women get this mixed up with urinary tract infections. So, it's best to be tested and treated. The treatment is taking an antibiotic, either Flagyl or Silicet, to prevent being infected again. All sexual partners should be treated at the same time. You can reduce your risk of infection by using condoms correctly every time you have sex. Some of the symptoms, some people don't have symptoms. However, symptoms may develop over time. In women, one of the symptoms is a large amount of thin, often foul-smelling discharge from the vagina, which might be clear, white, gray, yellow, or green. Genital redness, burning and itching, pain with urination or sex, or discomfort over the lower stomach area. In men, it rarely causes symptoms, but some of the symptoms are itching or irritation inside the penis, burning with urination or after ejaculation, or discharge from the penis. Please see your doctor, your provider. They can get this treated very easily with antibiotics, and they can treat your partner. Some of the risk factors are having sex with multiple partners, a history of other sexually transmitted infections, a previous episode of trick, and then that's the other word for it, trick. Sex without a condom. It can cause pregnant women to deliver too early, have a baby with low birth weight, or give the infection to the baby as it passes through the birth canal. So, they generally check when a woman's pregnant at their first prenatal visit. They generally check for these STIs. Okay, so the next one we're going to talk about is HIV/AIDS, and I know everybody has heard a lot about it, but it is a chronic, potentially life-threatening condition. It's caused by the human immunodeficiency virus. It damages your immune system and interferes with your body's ability to fight infection and diseases. HIV is sexually transmitted. It can also be spread by contact with infected blood and from illicit injection drug use or sharing needles. Some of the symptoms are fever, headache, muscle ache, joint pain, rash, sore throat, and painful mouth sores, swollen lymph glands, mainly on the neck, and they're generally down here. And some of the signs and symptoms include, did I already do that? I think I already did. Fever, headache, muscle aches, and joint pain, rash, sore throat, and painful mouth sores, diarrhea, and weight loss. Cough and night sweats. When you have a symptomatic HIV infection, as the virus continues to multiply and destroy your immune cells, you can have fever, fatigue, swollen lymph nodes, diarrhea, weight loss, oral yeast infection, thrush in your mouth, on your tongue, shingles, pneumonia. Progression to AIDS. Some of the signs and symptoms of this is sweats, chills, recurring fever, chronic diarrhea, swollen lymph nodes, persistent white spots or unusual lesions on your tongue and your mouth, persistent unexplained fatigue, weight loss, weakness, or skin rashes or bumps. If you even suspect that you have HIV or AIDS, please see your healthcare provider. A simple blood test can tell if you have it or not. Like I said, it can spread through sex, sharing needles for IV drug use. So, just be careful with this. This is very dangerous. A very dangerous STI. Prevention, again, don't share needles. Be careful with who you're having sex with. Have yourself and them screened before even having sex. And remember, the best way to keep from getting an STI is either abstinence, which means don't have sex, or being very, very careful. So now we're going to switch over to syphilis, which is another sexually transmitted infection. And syphilis is very high in the Native American community right now. Syphilis starts as a painful sore, typically on the genitals, rectum, or mouth. It spreads from person to person via skin or mucous membrane contact with these sores. After the initial infection, the syphilis bacteria can remain active in the body for decades before becoming active again. Early syphilis can be cured sometimes with a single shot injection of penicillin. Without treatment, syphilis can severely damage the heart, brain, or other organs and can be life-threatening. Syphilis can also be passed from mothers to unborn children. Syphilis develops in stages and symptoms vary with each stage. Primary syphilis, you will have a small sore called a chancre. The sore appears to be on a spot where the bacteria entered your body. While most people infected with syphilis develop only one chancre, some people develop several of them. The chancre usually develops in about 3 weeks after exposure. Many people who have syphilis don't notice the chancre because it's usually painless and it may be hidden within the vagina or rectum. The chancre will heal on its own within 3 to 6 weeks. Secondary syphilis, within a few weeks of the original chancre, you may experience a rash that begins on your trunk, but eventually covers your entire body, even the palms of your hands and soles of your feet. The rash is usually not itchy and may be accompanied by wart-like sores in your mouth or genital area. Some people also experience hair loss, muscle aches, fever, sore throat, and swollen lymph nodes. Then it can move on to latent syphilis if you're not treated. This disease moves from the secondary stage to the hidden latent stage where you have no symptoms. It can last for years. Signs and symptoms may never return, or the disease may progress to the third stage. About 15 to 30% of people infected with syphilis who don't get treatment will develop complications known as tertiary syphilis. In the late stage, the disease may damage the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years after the original untreated infection. Neurosyphilis. At any stage, the syphilis can spread and, among other damage, cause damage to the brain and nervous system and the eye. Congenital syphilis. Babies born to women who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some experience a rash on the palms of their hands and the soles of their feet. Later signs and symptoms may include deafness, teeth deformities, and saddle nose, where the bridge of the nose collapses. However, babies born with syphilis can also be born too early, may die in the womb or before birth. They also check you when you are pregnant. They also check you for syphilis. So, that's one of the blood tests they do on you, because you really don't want your baby to be born with syphilis. Some of the rare risk factors are if you engage in unprotected sex, have sex with multiple partners, are a man who has sex with men, and are infected with HIV, the virus that causes AIDS. Without treatment, syphilis can lead to damage throughout your body. So some of the neurological symptoms in the later stages is a headache, stroke, meningitis, hearing loss, visual problems, including blindness and dementia, loss of pain and temperature sensations, sexual dysfunction in men, and bladder incontinence. So, the syphilis, like I said, it's really high in Indian country right now. And congenital syphilis, which is passing syphilis to your baby, is really high. A lot of Native American babies are being born with syphilis. So, better to protect. And thank you, that's it.
Well, let's see. How often would you say someone should get tested?
Every time you have a new sex partner.
Every time a new sex partner? Okay, so like if they got treated for an STI or STD, and they can't be in contact with it again, or is it permanently cured?
No. Anytime you have you are sexually active with a person who has it, you are going to get it.
All right. And once again, who is more prone of contacting the STI or STD?
Anybody's prone.
Anybody?
Anybody who's sexually active is prone if they have sex with a partner who has the infection.
All right. Well, thank you for joining us today on Facebook Live. Thank you, Lora, for joining us. If you have any questions, please leave it in a comment, or else you may contact Lora Langley. Thank you.